Hi everyone, good morning. It's noon on Friday and it's our third time together. The first time we were able to do a Zoom, but oh my gosh, the internet got crazy. So we did a live Facebook yesterday last Friday, and today's our third one. And I think we have one more this week as well. And I think I wanted to first introduce you to my beautiful little baby, Inka. And so here we are, very interesting, exciting to be here. You know why? Because last night was one of those, if you know me, if you've been following me for any length of time, you know that I'm a night person and not a morning person. So noon is like my probably 7 o'clock for you, for some. So last night was an all-nighter for me. This week has been a lot of all-nighters. We've had a pretty busy week, but Inka slept all the way and I woke up at 11:30. So bedhead, whatever, here I am. So I did get two questions that I'll start with, and then maybe that will intrigue you to ask some questions for yourself. And here's the cool thing. Hi, Christy. Hi, Allison. Hi, Holly. So the two questions that I got are not even hormone questions, which I fully welcome because, you know, I'm board certified in family and geriatrics. So I've got a pretty large realm of knowledge here to share with you. Okay, I'm gonna hand off my baby. Bye. Thank you. Could you get me a cup of coffee? Okay, so I gotta get my first cup of coffee. So I want to get a model for you because one of the questions was about arthritis, which was, well, a type of arthritis. I had to ask some questions, some additional questions to find out what was happening. But this is a 66-year-old woman, postmenopausal, about 10 years, does not use any hormone replacement therapy. And she reached back to pick up something in the back. Oh, you know what it was even more so? She reached down to pull her underwear down to go to the bathroom. That's what it was. So her arms went behind her and she went to pull her underwear down, and she had this massive pain in her shoulder that went down the front. Not exactly the front, but center front. So a little bit in the front and in the middle. Excruciating pain that she had to stop, and she said she had to pull the rest of her underwear down with just her left arm. And she wanted to know, oh my God, what do I have? What's going on? You know, what do I do? I'm babying it. I'm not doing anything with it because I'm afraid I'm going to hurt it even more. Well, thank you so much. Well, first of all, it's extremely important to delineate the difference between an injury or a condition coming from the neck versus one coming from the shoulder. There's also things that can come from the back. So the one that is coming from the neck, you can feel all the way down to your fingers. If it's coming from the shoulder, it's most often felt right in the center front here. Interesting, right? So hers is very indicative of shoulder. She had no injury at all. So I started asking more questions about hormones and all that kind of stuff. She's not ever been on hormone replacement therapy because she's afraid. She was told that could cause cancer. So I'm sure you guys are really thinking to yourself now, okay, all right, we know what kind of doctor she sees. In any event, I wanted to just share with you what I told her about this. Now, if you have, this is very classic of early frozen shoulder. So her ability also to fully move her arm up is limited. She can move her arm up to about here now. So she feels like it starts to hurt as she moves her arm up. That same pain starts coming down the arm. So it's bringing it back and bringing it up. She can do this fine, but it's getting it all the way up like this. I mean, we should have full range of motion of our arms like that. Okay, so frozen shoulder is her very likely situation. And frozen shoulder is extremely common in us, in midlife women. We don't know exactly why thyroid has something to do with it, except that thyroid is very dependent on balanced sex hormones as well. So it may be the sex hormones and not the thyroid that is actually puts a person at higher risk of frozen shoulder. So frozen shoulder is extremely common in postmenopausal women, very common. And we do know that estrogen, and this is going to make total sense to you, estrogen is responsible for keeping the collagen elastic. So collagen is in our skin, collagen is in all of our vessels, in our heart, in the valves of our heart, and of course, all in each and every joint. So collagen, it helps that elasticity of these things. So even high blood pressure, if you think about how if the vessels get stiffer when the heart pumps, it makes the vessels are supposed to expand out with each pump and then come back in, and expand out and then come back in. But if that elasticity is no longer present, then they're more like pipes. So the heart pumps and it's a pipe, it doesn't expand. So what happens is the pressure goes up. It's like if you picture a bottle, or no, not a bottle, because that's glass, that doesn't expand, or a can. Let's say you push fluid in a can, and it's a closed can because our arteries are closed system. Closed system means that nothing can get out. So if from end to end, you can't get out unless you stick a needle in there, right? So if you increase the pressure with a pump, then the pressure is going to go up. So if you increase that pressure. Okay, so what did I tell her to do? Well, there is only one way to get rid of frozen shoulder, and this is really the truth. And there are people who suffer with frozen shoulder for 6 months, a year, sometimes 2 years. Sometimes they never get over it. Now, the first thing, you have to make sure you have frozen shoulder so there's no structural damage of the joint itself. So you have to do, generally speaking, unless you've had it before, unless you're sure. Now I was talking to this person by phone, so she does need to have an x-ray. We need to make sure first that she doesn't have a structural problem. She had no trauma. She just woke up with it. You know, it was just something that just happened. So no trauma. This is very likely it. So once you know for sure that you don't have a structural oddity in that shoulder or joint, then frozen shoulder is only fixed one way. This is where pain feels great. And once somebody knows that, they can get rid of their frozen shoulder. So a lot of people are afraid to put themselves through pain because they're afraid that they're going to be hurting themselves more. The truth is, range of motion is the only way to get rid of it. And it's not just physical therapy 1 day, 3 days a week, even though that's wonderful because that will give you a program to follow. The key to physical therapy with frozen shoulder is doing it for 1 minute, 4, 5, 6 times a day. 1 minute, 4, 5, 6 times a day. And one of the best exercises to get rid of a frozen shoulder, you can have frozen other things, but shoulder is the most common because our shoulder is the most mobile joint that we have in the entire body, you know, much more than our hip. This one is just really massively mobile. But the exercise that works fabulously is to take your hands, cup it on the top of a door and hang there. Yup, you heard me. So if you're not there yet, if you have frozen shoulder and you can only lift it to say this high, you may not be there. So you have to push it, push it, push it, push it, and hold it, and then bring it down. And you might want to bring it down slowly because you've pushed it, pushed it, pushed it, and then bring it down. Do that for 1 minute, 4, 5, 6 times a day, and you'll be done with your frozen shoulder in 2 weeks. That's the only way to do it. Now, in the meantime, I did recommend to her, I have a finger that acts up during, this is my dad finger. My dad died last year, just a couple weeks before he died. I was helping him put his shoes on, and my finger got stuck in his shoe, and it damaged my joint. And so every time it rains, it gets swollen. So really badly. So I love my finger. It's my dad finger. So what I do is I put a little bit of Voltaren gel. This is diclofenac. It's upside down. Diclofenac, 1%. It is an anti-inflammatory. So this is like an NSAID. This is like a Motrin or Advil, but it's instead a cream. So I don't like to take something, I don't like to swallow something for something on my finger, right? That's silly. So this is a topical, this is the generic Voltaren, the generic Voltaren. I do like it. You can use up to this much, a whole fingerful 4 times a day, and you saw I only used a tiny little drop on that one joint. So I told her, let's use this on your shoulder, okay? And let's also add all our natural anti-inflammatories, or at least the ones that are going to give you the biggest bang for your buck. Your turmeric at 1,000 milligrams a day, and your essential fatty acids. There's a couple of ways you can do it. I love sorry about this, but I love cod liver oil for this kind of thing because it has a lot of vitamin D in it, which is also super important for joints. So the cod liver oil, my favorite is Carlson's. You guys, if you like any, then you can certainly throw it out there. People are always enjoying suggestions. But cod liver oil, it's really good. Carlson's with lemon. You get it from the refrigerated section of the health food store. That's my favorite. There's also a lot of other wonderful oils out there, and I do use cod liver oil for some things, but I also use other oils as well. But that's a good choice. So that's a story about frozen shoulder. It is definitely able to get rid of. You can get rid of that bad boy in 2 or 3 weeks. And when you're doing your exercises, when you're bringing it up, anybody can do 1 minute, 4, 5, 6 times a day. When you feel that discomfort, you're like, yeah, that feels good, that feels good, that feels good. And that's the mindset that you get when you're going after getting rid of a problem. So that's frozen shoulder. You got to make sure that's it. Now I'm going to do a quick, Christy asked a good question. Do you trust hair analysis that tests for food sensitivities? I'm going to answer that. And so let me just look at all these wonderful people watching. And here's another question. Why do some doctors say not to use estradiol if after the 10-year window? That's a great question. Okay, again, 53, ablation, 30 years old. Okay, so the reason why is very, very simple. I love the fact that so many things are simple. COVID, what's going on with that is not simple. The reason is 10 years because that's all the studies we have. So in that 2002, the study that was stopped in 2002, the Women's Health Initiative, it had been going on for 10 years. It had been going on for 10 years. So when they stopped it in 2002 with the wrong conclusion and then later came back with the right conclusion in 2006, 2007, 2012, again in 2014, that estrogen did not increase the risk of breast cancer, that in fact it lowered the risk of breast cancer compared to the placebo, that it was the progestin, the synthetic progesterone in the other arm of the study that had Premarin, and the synthetic progestin, that was the one that increased the risk of breast cancer, just like oral contraceptive pills. So when they finally found that out and 4 times confirmed it, then they said, but after 10 years, you need to get off of it because we don't have any idea. Well, that is actually true. After 10 years, they don't know. They don't know after 10 years because that's as long as the study went. So just like Dr. Fossey in the task force, he's saying, don't use hydrochloroquine. Don't use hydrochloroquine. We got to do studies. We got to do studies. It's saving lives. Conventional medicines, physicians have to say that. I don't blame them. They're trained that way. This is their life. This is the way they think. This is the way they live. We all have that. We all have something that we have to stick to, right? So I don't blame them for doing that. But that's why in conventional medicine, we love those numbers. We love that proof. Because if you have that proof, because really when you say your oath, the very first thing is that you do no wrong. So the last thing you want to do is do no wrong. But you see, some people can't look at beyond their nose, so they can't see the big picture. They're only looking at what's right in front of them. But women are better at that. We're standing on the mountain looking down and seeing things a lot better. So in reality, women have been on estrogen for 50, 60 years. And if you examine the data really carefully and go into functional medicine and go that route, then what you learn about that 10-year mark, it's not about the estradiol, it's about the estrone, E1. So E1 is not a stronger estrogen than estradiol, but it has bad metabolites. So if your body is one to either have a high estrone level, and as we get older, our fat tends to go up, which is something that does not have to happen. But if the fat level goes up, often the estrone level goes up because estrone is produced by fat cells. So after menopause, we're not making that estradiol from our ovaries, we're making estrone from fat cells. So our risk of breast cancer is higher for women who are heavy set than women who are thin. So that's why it's like an onion that you have to keep peeling open. I hope that answered your question, Paige. Thank you. That was a super good question. I am going to just make sure. Look at all. Hello. Okay, I passed that other one, and where was it? That was another good question. Excuse me. What was it? Oh yeah, the hair analysis. Hi Nancy. Hi Jody. Hi Sonia. Okay, Sonia, didn't you have frozen shoulder? I believe I remember you had frozen shoulder one time. I think, I'm not sure. But anyway, okay. So, and don't let me forget, because the other question that I got was on constipation. So it's not about hormones, but hormones have something to do with constipation too. So I wanted to talk to you about constipation, because we're about, with the Savvy Sisters, getting into the elimination portion of our gut cleanse. And here's the surprise. The Savvy Sisters want to share it with you guys. So you're going to be following us and about a couple weeks behind us. And we decided that we need to give. We need to give some more. So we're going to be sharing the entire Squeaky Clean to Lean with you. So it's not just about losing weight, even though we do lose weight when we do a cleanse. It's also about cleaning up our gut for a healthier immune system. And we're like, everybody needs this. It can't be something. Everybody has to have it. Okay, so constipation is a big issue related to that. We have to get the bowels moving very, very nicely and smoothly every morning, and nice every morning, or whatever your time is every day, to have a very easy, smooth, large, satisfying, whatever, stool. Okay, so those of you who know me, I'm not shy about that at all. Not shy about anything. Okay, so the hair analysis, Christy, good question. No, I don't trust them. No, they have been so unfortunately misproven. Boy, do I sound like a conventional doctor now? Maybe. I don't trust them. I really don't. I mean, if let's say you have a completely virgin hair, you've never put any product on it, and you've used only organic products to clean your hair, maybe I would look at, what that had to offer. But for the vast majority of people, they do things to their hair. They put products on their hair. They color their hair. This hair is not this is not the part that is breathing and alive, right? So no, I really don't. This is a subject, though, of contention, not with just conventional versus functional. It's with everyone. Functional docs, conventional docs, none of us really like the methods of testing for heavy metals. To test for heavy metals, you have to get the metals to come out of the organs, because the heavy metals are stored in tissue. They're stored in the liver. That's why we've got to do this GI cleanse. You've got to cleanse to get rid of them. So they're in heavy metal. They're in liver, they're in muscles, they're in all of your tissues. They can be in your joints, they could be in your heart. They're stored in there. To get a measurement of your stored heavy metal, getting it out of treated hair is very controversial and not been shown to be consistent. Consistency is everything. It's like a COVID test. Like, you have to, if let's say you have a positive person and you give them the nasopharyngeal swab test and they test positive. You give them a second test and they test negative. And you give them a second test 5 minutes later, right? The same day, right then. And it's negative. That test is not going to be worth anything. You can't have false negatives. That means it has a very low sensitivity. Don't worry about that. We want high sensitivity and high specificity. So, unfortunately, testing for heavy metals, there are no really good tests with high sensitivity and high specificity. That's just like 2 + 2 is 4. A conventional doctor and a functional medicine doctor are the same as far as that goes. They're looking for accurate results and accurate tests. So, no, unfortunately, I don't feel we can use that. Now, what is another test that people do, and it's the same thing with iodine. It can be problematic. But what some physicians do to get an idea about heavy metals, which is also controversial, is they give them a substance that helps their body release the heavy metal. And when the body releases the heavy metal, the liver, the muscles, the organs, when it releases the heavy metal, it gets into the bloodstream, and then it's measured by blood. The levels are very high. And so they say, look, you've got all these heavy metals. Every one of us have heavy metals. Every one of us. Unless you're just been through a GI cleanse and you've stayed organic and clean and not been around anything. You're like living in social distancing for a while. So yes, you could have very, very low heavy metals. There was a study done in Sweden that was fascinating. And what they did is they took a family, they tested them for not heavy metals, because that's not possible in urine, but they tested them for many different pesticides in the urine. And each of the members of the family, 2 adults and 2 children, had very high varying degrees and levels of toxins, different toxins, like glyphosate and all these different pesticides and herbicides. Then they put them on a complete 2-week cleanse. Herbs and amino acids to help cleanse the liver. All organic foods, no hormone induced growth hormone in their meats. And 2 weeks later, retested them, and all of them, there were little tiny levels, but extraordinarily small in all 4 of them, all 4 of the family members. That's fascinating to me, because what that says is the beauty of this amazing body that we have, right? This body that heals itself, right? Given the opportunity. So GI cleanse, really, you're going, Christy, I think you're going to do GI cleanse, because I know Christy's part of the circle. So that will help you remove toxins. It's part of the reason why we feel so lousy that first day that you're on. It's usually 1 day, sometimes 2 days, but that first into that first day, you don't feel very good. So you don't want to plan something. It's a perfect time to do a GI cleanse during social distancing. I'm in my little country place. So I have my little bear mug. David brought me this. So I have my water and my coffee. So when we do our GI cleanse, I can't have my coffee. And I'm a closet coffee drinker, but I don't cheat. Oh, it's blueberry. Okay, so let's see. There was that question. Hair analysis. Yes, I like that. Now, do you recommend bioidentical hormone replacement therapy after endometrial cancer? Fabulous question. Love good questions. A conventional doctor would say NO, and I delve in a little bit deeper than that. So first of all, what was done for the endometrial cancer? Was there any endometrium? Was there any endometrial tissue outside of the uterus? And was the endometrial cancer progesterone sensitive? So for most overgrowth of endometrium, including endometrial cancer, it's sensitive to estrogen. Estrogen makes it grow. So it's kind of like breast cancer, where breast cancer doesn't cause breast cancer is not caused by estrogen, but if you have breast cancer, if it's estrogen sensitive, it can grow from estrogen. Okay? So I think I'm going to say that again because it's pretty important with breast cancer and endometrial cancer. These tissues don't get cancer because of estrogen, but if you have high levels of estrogen over the level of progesterone, if your estrogen and progesterone are not balanced and you're in an estrogen dominant state, it can make the breast cancer and the endometrial cancer grow. There's a confusion about that estrogen dominance. Estrogen dominance occurs when progesterone goes down. This doesn't change. It could even be going down. Your estrogen could even be going down, but the progesterone goes down faster and more significantly, leaving you in an estrogen dominance. So too much estrogen compared to the imbalance of the progesterone. And so those tissues have both estrogen and progesterone receptor sites. And if your progesterone goes down, and even if your estrogen goes down, even if this goes down, the receptor sites of estrogen are going to be stimulated, but not the progesterone. There's going to be a lack of adequate stimulation of the progesterone receptors to counteract the effects of estrogen. So these progesterones are low and the estrogen is low too, but it could be low or it could be high, either one. It's estrogen dominance. And that makes these cancers thrive. They make these cancers grow. It doesn't cause them, but it makes them grow. And that's why they take estrogen away from women when they have estrogen sensitive cancer. That's why it's such a good question to say, do you recommend BHRT after endometrial cancer? If you've had your uterus removed, and many people have their uterus removed after endometrial cancer, sometimes they don't. If it's a small, very early endometrial cancer and they've gotten it all out, then I treat it the exact same way that I do a breast cancer. And that is, yes, I do bioidentical hormone replacement therapy and keep them way out of estrogen dominance. Way out. Some people I only use progesterone, and other people I use progesterone and estradiol. So I do not use estradiol, and I never use estrone, but I monitor them closely with estrone, estradiol, and estriol, E3. Estriol cannot convert to estradiol or estrone. It's the end of the road. Estrone, though, can convert to estradiol. and estradiol can convert to estrone. These can go back and forth, and they both can convert to estriol, E3. But E3 doesn't go anywhere, and it's our weakest estrogen. So yes, I do. If there's so many benefits of bioidentical hormone replacement that I'm forgetting about the woman's heart, and I'm forgetting about the woman's brain. And so I don't believe in forgetting about the brain and the heart when the endometrial cancer has been solved. It doesn't make sense to me. That's the typical functional medicine view versus conventional. Conventional is scared, and I don't blame them. But I am scared about everything I do. It's not about hormones. It's about everything. It's about prescribing this. It's about recommending this, a natural product. Every single product that I recommend or prescribe, all right? Every single one. Hey, look. A phone number. David hates when I wreck these. Every single one I take seriously. Part of the reason I'm so slow when I take care of patients is I'm going over and over and over in my mind, that making sure I'm choosing what's right for that person. So I'm not ever cocky about anything I recommend. But so the way I think about it is, if that could potentially be me, what would I do if that was me? What would I do if that was my mother or my best friend? So that's how I make a decision about bioidentical hormone replacement therapy for anyone. I've recommended bioidentical hormone replacement therapy many, many times for women who have had breast cancer. It might be progesterone, that's bioidentical hormone replacement. And it might be estradiol with progesterone. But it's rarely estradiol. I don't even know if I can think of anybody that yes, I have had somebody on estradiol, but it's a rarity. I hope that answers your question, because unfortunately, Gemma, there's a few more. You go ahead. You got any more questions related to that, or anything more you want to tell me about your story? We're here next week. I'll answer for you. That's a fabulous story, because you're not alone, honey. There's a lot of people that have had endometriosis, which also, it's not a cancer, but it is an overgrowth. And that endometriosis can come out of the uterus. It can go up the fallopian tubes, and the fallopian tubes are just these little, they have these little finger-like projections at the end of their tube, and they kind of cup over the ovaries, but there's a space in between the ovary and the tube, so that endometrial tissue of endometriosis can literally climb up the tube and come out into the abdomen, and it can be a real mess. It can sit on top of the bowel, the outside of the bowel in there. It can cause adhesions to the bowel. People have had to have surgery to debulk and take that endometrium off of the colon. That's very serious. And they are probably very highly estrogen dominant, which when I see somebody like that, I worry, about the other parts of their body. They're too high of estrogen compared to the progesterone for their breasts, for instance. So for many of those, I put on progesterone. Okay, so let's see. Hello, Dr. Karen. Hello, Nancy. Okay, thanks. Okay, hi, Denise. All right. Hi, Angie. All right, help. My hair has been falling out door a year. I bet you it's been falling out. But, okay, did a metal cleanse a year ago, but has not helped. I'm hypo and take Armor and do pellets about every 6 months. Take vitamins too. What tests can I take to find out what my hair needs? Lisa, you savvy lady. I got to break this question up. did a metal cleanse a year, so your hair is falling out and that's freaking you out. My God, our hair is so important, isn't it? It's important to us until something happens and we lose our hair and that other thing is more important, really, is the truth. But all in all, our hair is important to us. And if, we had to have chemotherapy and lose our hair, then our bald head is important to us. So, we can take everything in reference, right? But our hair is important to us. I mean, ugh. Okay, so did a metal cleanse a year ago, has not helped. So you're hypothyroid, take Armor and do pellets. So when somebody tells me they do pellets and they take Armor, I like Armor. It's 4 parts T4 to 1 part T3. T3 is 4 times as strong as T4. And our synthetic treatments for hypothyroidism is like Synthroid. There's another one called Tyrosint. But Synthroid, which also is levothyroxine, is only T4. It's 100% T4. So people who have difficult time converting T4 to T3 aren't going to do very well on the synthetics like levothyroxine because their T4 goes up, but their T3 doesn't do anything or doesn't do much. It's often a nutrient deficiency, but there are other problems with it too. And let me tell you, stress is a huge problem with converting T4 to T3. And she takes vitamins. She says, so the nutrient deficiency, zinc, selenium, iron, the minerals, it's not likely, because when people say they take vitamins, they usually mean vitamins and minerals. So I'm suspicious of 2 things. One, is the free T3 appropriate level? Is the free T3, is the conversion from T4 to T3 appropriate? So often thyroid was when I had my office for midlife women, was a huge part of our practice because doing thyroid is not easy. You've got to look at T4 and T3, and I'm talking about the free levels, and you've got to look at how women are converting their T4 to T3. Now, this is super important because thyroid is so controversial with the numbers. What is the right number? What is the right number? There have been so many studies that have shown if you properly take your thyroid medication and you're being managed, you have almost 0% chance of becoming hyperthyroid. 0%. Even if your TSH drops way below normal. And in fact, the lower the TSH, supposedly, the more active the thyroid hormone, the more thyroid hormone you have if your TSH is low. Now, why is that? There is a feedback loop system in the brain. So it starts in the brain. The brain senses that the body needs thyroid hormone. And when the brain senses that, because the brain is the commander in chief, so it senses everything. So when the brain senses that its organs need more metabolism, need more thyroid hormone, it will send a message to another part of the brain, the pituitary gland, and tell the pituitary gland to make something called TSH, thyroid stimulating hormone. So thyroid stimulating hormone, that's all it is. It stimulates the thyroid gland to make hormone. That's what it does. So that comes from the brain, goes to the thyroid gland and says, hey, make hormone. I'm the TSH, thyroid stimulating hormone dude, and I want you to make more thyroid hormone. So the thyroid makes T4. And then out in the bloodstream, that T4 converts to T3. Now, it doesn't convert to only T3. If it could convert only to T3, we'd all be great. None of us would have hypothyroidism. But it doesn't do that. T4 is up here. And it converts either to T3 or reverse T3. So when it converts to reverse T3, that's totally inactive thyroid. So T3 is 4 times as strong as its originator T4, and that's the one we want, but it also converts to something called reverse T3. And if the pathway is pushing more of the T4 into the reverse T3 production, then you're going to be hypothyroid, even if you take T4. And even if you take Armour, because Armour is a desiccated thyroid hormone. It comes from bovine or pig thyroid. So it has, actually more than just T3 and T4 in it. There's T1, T2, T3, T4. But the others are so weak they don't even mention them. But T3 is 4 times as strong as T3, and it comes in a part of 4-to-1. So you still have more T4 than you have T3 with your Armour. There's something called Cytomel, which is T3 only, and often I would have to actually combine these medications. Sometimes I would have to use a T4 only with an Armour. Sometimes I'd have to use an Armour with a T3, right? And in fact, I saw somebody on here that I did that with in my office. I believe we did that, Denise. I had all sorts of combinations to get people feeling good. But you have to be interested in it, because you have to, analyze it. It's fun though. This is the fun part about medicine, is specializing. That thyroid is fun. So that you would want to look at when you say I'm hypo and hair is still falling out. The other thing that I'm worried about, other than are you converting enough of the T4 that's in the Armour to T3, the other thing that concerns me is that I don't have any problem with pellets as long as the pellet dosing is proper. What I find most of the time with pellets is that the dosing is too high. The amount of hormones that we actually produce when we're 20 years old is really not very high. People would be shocked. We hardly put out any hormones, and the pellets are high. Now, with pellet therapy, they give estrogen and testosterone through pellets. And then you can't give progesterone through pellets. Progesterone is the hardest hormone to actually, pellets are topical. They subcutaneous, so they're really being absorbed topically. So they're just right under the skin in the subcutaneous tissue. So they're released slowly. Some people's pellets last them 3 months, some last them 4 months. And I don't like pellets for the first time. I like people to know what their doses are and be very, very clear with their doses before they actually get anything injected, because I see a lot of people with either mood disorders from too high a testosterone or an imbalance of estrogen dominance because you can't give progesterone through pellets. So you have to give, so what they usually give is an oral progesterone. Usually it's like a Prometrium or a generic Prometrium. This is also a problem because Prometrium and the oral progesterone is short acting. It only lasts 6 to 10 hours. So you're estrogen dominant the other 14 hours of the day. So if your oral progesterone that you take before you go to bed, it's gone within a few hours after waking up. So all day long you're estrogen dominant. And this is not easy on the mood. It's also not good for breasts or uterus and many other organs, I'm sure, that are dependent on progesterone and estrogen balance. So that's a problem that I have. So with women who want to be on pellets, I said, well, at least do your progesterone topical in the morning, keep yourself out of estrogen dominance. That makes me feel a little better. Testosterone levels are usually too high. Why? Because a lot of women who go to get pellets are thinking that the testosterone is going to help their libido. And so in order for any libido to be improved, often levels have to be very high for a woman. So what they're testing is blood. So it's a topical, it's subcutaneous. It's more like a topical hormone. So topical hormones are carried through the lymphatic system, not through the blood. There's only a small amount of hormones seeping into the blood at any time. It's a tiny little bit, and then it's taken up by the organs. The hormones are not floating around in the blood. They're in the subcutaneous tissue, stored in the fat, and then released as an organ needs it by the brain recognizing that the organ needs it. The commander-in-chief says body needs, let's say, testosterone. Heart needs testosterone. Heart loves testosterone. Heart needs testosterone. Brain recognizes that. Release testosterone. Body releases testosterone, travels through the blood, goes to the organ, is taken up inside the cell, is no longer measured in the blood. You have these tiny little amounts in the blood. So when pellet therapy measures your hormones in the blood, they're doing you a disservice. They're giving you more hormones than you need. So often what I see is it's too much testosterone. That's being converted over to dihydrotestosterone. That dihydrotestosterone is seeding itself inside the hair follicles. If you look up female pattern baldness, male pattern baldness, this is what you'll find. What happens is the testosterone is converted over to dihydrotestosterone. And that is what sits in the follicles of the hair and causes the follicles to get smaller and smaller, the root, the ball of it. And the root gets skinnier and shorter, and then the hair eventually falls out. 2 years of that, and the hair won't grow back. If you catch it before that, if your dihydrotestosterone is high, it's the same thing that causes enlarged prostate in men. They get the bald head, they get the enlarged prostate from dihydrotestosterone. So it's the blocking of that conversion of testosterone to dihydrotestosterone that helps stop the hair loss. But you also have to make sure that your testosterone levels are not too high for a woman. Now for men need higher testosterone levels, so they are much more likely to have bald head. But for us, I don't think we want our testosterone levels so high that we lose our hair. Or grow a mustache or what have you. And some women don't even get a little bit of a mustache. Some women get a mustache with just a tiny little bit of elevated androgens, DHEA or testosterone, but they don't lose their hair. So we know that there's more involved, and also male pattern baldness and female pattern baldness are genetic. They are genetic. So you will see this in other family members. So it's like you have to have a gene for it. And if you have that gene or that something part of that gene for it, then that dihydrotestosterone can affect you. So that is what I'm suspicious about. Are you converting your thyroid over to the active T3, or do you need T3? Not the reverse T3. You need to measure that too, reverse T3, and see where that's going. And I would also measure your dihydrotestosterone. Okay. Okay, that was a good question, Lisa. Thank you. Very interesting on Sweden. Yes, Sweden is an interesting country for sure. Okay. Yes, Anna. The Swedish studies are very encouraging. She says, this is very encouraging to me too. I mean, I know. All we have to do is take care of ourselves and we get better. Okay. Dr. Karen, I'm because all you guys are gonna be love this, and I worked until 5 a.m. on this. You guys are gonna be a part of this sign-in portal. You're gonna be able to get into the portal with a password and be able to reach all the videos that are part of the Squeaky Clean to Lean. And that's going to be a way for you to learn how to reduce the toxins in your body. So it's not just about losing weight. It's about removing toxins, and it's about looking younger and feeling younger. Because when we feel, the truth is it's hard to motivate people when you talk about let's prevent diabetes and cancer and let's prevent heart disease, people don't get motivated from that, but they are more likely to get motivated by saying, let's look better, let's feel better. And the one thing that there is easier to motivate people about regarding that is really more about just generally feeling better and looking better. But if you take it to the next level, there's a lot of ripple effects. And those ripple effects have a lot to do with a woman, because we control the aura of our environment. I mean, we do, ladies. I mean, if we're happy, then our families are happy. And when we're not happy, everybody's all, stressed out and been out of shape, right? We control it. And I like to use the example of, like, let's say you go out to eat with your family and your waitress brings you your meal and it's not what you asked for, or they put the salad dressing on the salad and you ask for it to be on the side, and you get all grumpy and bent out of shape. The whole table feels it. And everybody's a little bit like, disruptive. But if you look at your salad and you say, oh, I asked for it on the side, I'm sorry. Oh, that's okay. Oh, I'm so sorry. Let me get you another salad. And it's over. Everybody's happy. So when we're grumpy, the whole family feels it. So it's easier. So those ripple effects, also, which you don't even think about, are teaching your kids and your grandkids how to act and feel and be, and teaches them resilience that lasts each lifetime. So we're changing the world, is the truth, the way we act. So we're in charge of that. So that's why feeling good is so important, right? It's a big responsibility, ladies. Okay, what was the question? I've tried a few times to take amino acids and always end up with acid reflux. With amino acids? Jody, that's interesting. So you know what amino acids are. Any suggestions on how to be able to take them? What kind of amino acids, my darling? Let me know right now. Because amino acids are simply the individual components of a protein. So do you get that with protein? Because maybe you don't have enough protease, right? Maybe you're not digesting protein. Let's find out a little bit more on what that acid reflux is about. The other thing that I did write about last night is hydrochloric acid, this is very well known, but it's still a real problem in conventional medicine. As we get older, we produce less hydrochloric acid to digest food. So our protein is not that easy to digest, and that's why food sensitivities come from undigested proteins, not undigested fat. That's digested by lipase. Protease and protein enzymes that break down protein all of our enzymes are also reduced as we get older. So, think about it. We used to go through menopause and die. 100 years ago, the life expectancy, we have gone down a couple years, unfortunately. I don't know if it's been a whole couple years. Maybe it's been a year. Our life expectancy actually went down a year this last couple of years. So we've gone down 2 years in a row. That's really bad. And it's probably because of diabetes, complications of diabetes and obesity. But our life expectancy was going up. 100 years ago, we went through menopause and we died. So nobody really needed or thought about hormone replacement therapy. A lot of people also died from other things, childbirth, strep infections, erysipelas, different things surgeries, they did surgeries without using gloves. There was nothing sterile. It was gross. So there were other reasons for people died young. But the average woman, if she made it through childbirth, then, she would die shortly after menopause. Now we're living so much longer that, we also have help from certain things. People died of polio and people died of measles. So I don't like all the vaccines that are coming out now, but there are certain ones that I certainly like, and I'm looking forward to COVID vaccine. Okay. I'm kind of worried about it being pushed out fast, but I'm looking forward to it. In any event, there's a place and time for everything is the way I feel and the way most functional medicine doctors feel. There's a spectrum of everything. There's the two ends of the spectrum, and then there's the middle. And sometimes we want to work toward this end. If you have appendicitis, we want to have surgery. If you have a massive heart attack and you need to open your vessels, we need surgery. And that's a great time to be in the hospital. But for most chronic diseases, we need to be over here in the prevention and natural treatment. We don't need to be taking as many medications as we take. Now, sometimes we're in the middle. And I would say to patients, look, I know we don't want to take this high blood pressure medication, but right now, if we don't, then you're going to get a stroke. And so let's work on the natural way to get your blood pressure down. But in the meantime, let's use this medication to help you do that. Okay. So this is the spectrum of what medicine should be, in my opinion. Integrative. That's what originally we talked about, integrating functional and, no, functional's over here, and conventional. And then what happened was we were integrating these things 20 years ago, and then everybody went overboard and went just functional and gave up conventional. And then that put this big wedge in between the two. That never happened to me. I stayed integrative, okay? And there's still a lot of us out there, but try to realize that there's a time and place for everything. Your essential oils are not going to heal endometriosis. I'm sorry, it's not. Your essential oils are not going to get you out of estrogen dominance. It's going to help your symptoms tremendously. I have essential oils in almost every major room of my house. So they're very valuable to me. In any event, let's stay integrative, and that's my opinion. So I'm not sure about the amino acids. What I was talking about. So our acid level goes down as we age, and people get more reflux as they age. What we know is that when the acid level goes down in the stomach, the digestive process is inhibited. So what does a conventional medicine doctor do? You come in, I have heartburn, I have reflux. You get an acid reducer. This puts you at higher risk of not digesting your food, not absorbing your nutrients. And what generally you need, well, first, if you have acid reflux, you really need to be tested for a bacteria called H. pylori. Look it up. Once you hear this, you're going to freak out. If you're on an acid-reducing medication, you're losing bone. If you're a midlife woman and you're on an acid-reducing medication, you're losing bone. And the number one cause of aging is not diabetes, it's immobility. Bone problems. If you have the frozen shoulder and you can't put your arm back here, you can't pull your pants down, and you can't reach back and get your push or whatever. It's the strength that we have in our bones and our muscles that cause aging. And also dementia causes aging. So that's rapid aging. But our musculoskeletal system. So the digestive process is incredibly important for every single thing in our body. And if you have low acid, then you have a very high risk of getting this bacteria called H. pylori. As we get older, we all have the risk of getting H. pylori. It's very easy to get. You can get it from kissing. You can get it from food. It's pretty common, H. pylori. That is a awful bacteria that has like a spiral end on it, and it burrows itself down in the tissue of the stomach. That causes gastric ulcers, reflux, and cancer of the stomach, H. pylori. It's a very slow, insidious process, and it's common, very common. So if you have reflux, you need an H. pylori test, period. That's functional medicine and conventional medicine. But it's hard for doctors to do that test because insurance says, oh, but you have to treat with an acid reducer before you can do the next step. So they give you an acid reducer, which is lowering your acid level and lowering your ability to digest food even more, and increasing your risk of H. pylori even more, therefore increasing all the other diseases associated with low acid levels, okay, improper absorption of nutrients because of improper digestion. And then if you have improper digestion of protein, the proteins are large. They don't get broken down into their tiny little individual amino acids. And those proteins are what cause food sensitivities and antibodies against those foods, and all the other things that happen, the headaches, the fatigue, the skin, the rashes, all itchy skin, all the things that happen with food sensitivities. Am I scaring you yet? Acid reflux, H. pylori test. You can get an H. pylori test. All you have to do is say, Doc, I want an H. pylori test. I need it. I need it. All right. I'm positive I need it. You've got to go in there. You've got to be strong, and you've got to be forceful. Period. And if they don't like that, then there's lots of other doctors out there. And you know what? When this COVID thing lifts, I got a hint for you. When we're allowed to start seeing our doctors for non-urgent things, go right away. Get your appointment right away, because a month after everybody's allowed to start doing it, it's going to get really, really busy. Doctors aren't busy right now. We are, because we go to facilities, assisted living and nursing facilities. So we're busy. It's the same. But most of the doctors' offices have a skeleton crew. They're only seeing a couple of people an hour. They're being, having to be just as careful. So, and people don't want to go to the doctor. I don't blame them. They don't want to go to a place that could potentially have this virus. So get your appointment sooner rather than later, and say, you know what, I need an H. pylori test because I have acid reflux and I've done some study on it, and I know that I could very well have H. pylori because of my acid reflux. Just tell it like it is, because I want to tell you, if you tell your doctor that, they're going to go, yeah, she's right. Okay? All right, so that was a question that Jody, well, let's go further with that, because I know you're in the circle. I don't take anything for menopause. I notice my libido is gone. Moods are no desire to do anything. I used to work out. I used to work out a lot, and weight gain is crazy. I'm 53, no more periods. I did Biot a few years back, and I loved it. Expensive though. I stopped. Is there anything you can recommend? Biot. Is that Biest? I did Biot, or maybe that's Bioidentical. Bio-T a few years back, and I loved it. Expensive though. I'm sorry. Forgive me. Let me reread this. I don't take anything for menopause. You're 53. I notice my libido has gone. Moods or no desire to do anything. Lack of motivation. I used to work out a lot, but you're not now. And so you gained weight. I'm 53. No more periods. I did Bio-T a few years back, and I loved it. Expensive, though. I stopped. Is there anything you can recommend? Well, yeah. I would do bioidentical. I mean, you know, I have to think about what would I do for myself? What would I do for myself? You know, I would use bioidentical hormones. I would not use the BioT if it's too expensive. You really loved BioT. If you do BioT again, make sure that you're balanced. I would use a topical hormone replacement. And you can't, if testosterone is something that really spoke to you, using it at the right doses is very good. That has to be prescription. You can get bioidentical hormones over the counter. We have our own line, Young Hormones. And it's, you know, expensive wise, ours is probably more expensive than some other ones out there, but it's the only one of the quality of hormones. And to me, it's like my nutrients. I was going to talk about constipation, so I actually happen to have this, but I get healthy, good nutrients. What I put in my body is not cheap. I don't use things that have fillers and things that I don't trust. So our line of bioidentical hormones are probably, and I think I know all of them that are out there. I've tried before we put ours out, all of them. And the base that our hormones are carried in is actually a very high grade base that actually releases the hormones in the system much better than what's out there. Hormones attach to fat molecules. So all these ones that you see with coconut oil and all of that, you're not absorbing it because it's not going through the skin. It's staying in the cream. Okay. I hate to say that. But in any event, our base is used in conventional medicine for conventional practices of everything from things that stop seizures to things that are placed for peripheral neuropathy, all topical products that have to get that medicine in, or that person is going to have a serious medical problem. So that's how ours work. So it's a higher level. It's a cleaner product. So it is a little bit more expensive, but one bottle lasts 2 months. So I don't know how much BioT costs, but the average bottle lasts 2 months and it is close to $80. Not quite, but close. Okay, so that's $40 a month for that. Now it doesn't have testosterone in it. Testosterone cannot be over the counter because it's a controlled substance, so you have to get a prescription for that. You can use DHEA. DHEA topical, it's important to know, DHEA topical stays DHEA. It is not converted to DHEA-S. The S is a sulfur molecule attached to the DHEA that occurs in the liver. And that's what we measure. You measure DHEA-S, both in the blood and in the saliva or in the finger stick. So we do also, if you can do that also with a blood finger stick if you don't produce good saliva. Now, why, if it's carried through the lymphatic system, how can you do a blood spot? How can you do a finger stick? Very good question you didn't ask, but I answer it anyway. If somebody can't get saliva, and there are some medical conditions where people can't get saliva, like Sjogren's, some autoimmune processes that have dry mucous membranes, and they can't produce good saliva, then a finger stick is a whole heck of a lot better than a draw from the venous blood. From the venous blood, it's like what I was describing before. Hormones aren't floating down in your blood and your blood pulling them out. The levels go up and down based on when the brain is saying, I need this, I need that. And it will release some topic if you're using topical, or if you're using BioT and it's subcutaneous, It's being released in small spurts by the command of the brain. And that's what you're measuring in the blood. And that's why doctors say, oh, it doesn't do any good to measure blood. It goes up and it goes down. That's right. That's exactly what it does. But it's constantly going through the lymph system. And the lymph system is not going through the liver. So blood spot, okay, a finger stick is as close to lymph fluid as you can get. Because lymph, there's an entire lymph system that is just like capillaries. So capillaries are the tiniest little vessels at the end of every artery. Every artery, the biggest one that comes out of the heart, they get smaller and smaller, and the arteries get smaller and smaller and smaller, and they go to every single organ and every single square inch of your skin. And at the tips of the skin, at the very surface of the skin, you do the blood spot anywhere. I get a kick out of that commercial, that diabetic commercial. No more finger sticks. You can do it in your arm. You can do that with any blood monitor, anyone. But wherever you take it, your lymph is right stuck next to the capillaries. It's part of right next to the capillaries, because the lymph and the capillaries are exchanging fluids all the time. So in a blood spot, you're not testing venous blood, you're testing blood that is connected and communicating nonstop with the lymph. So you're getting the proper levels of your hormones much better than if you're getting from venous. I still like saliva the best, but I like blood spot. I find it to be very accurate. So, when you're doing that, when you take a topical hormone, they don't go through the liver. They don't get converted to they don't get a sulfate. The DHEA does not get a sulfate. If you take a topical DHEA, it doesn't go through the liver, so it doesn't get sulfated. All right? So if it doesn't get sulfated, then what you realize, one of the downfalls is that this measures sulfated DHEA. So your topical often looks lower than it really is. If you take an oral DHEA, it gets sulfated and the levels will go up very quickly. A woman doesn't need that much. 5 milligrams, 10 milligrams of DHEA, unless you're under a tremendous amount of stress. If you're under a tremendous amount of stress, your DHEA does get consumed. And if it gets consumed, then you may need higher levels of DHEA. Okay, so that was okay. All right, so you can take DHEA. 50% of that converts to testosterone. So that's over the counter. So you can do that if you don't want to get a prescription for testosterone. I am currently not on testosterone. So people ask me that, well, are you on testosterone? Testosterone is so good for women. When I used it consistently, I liked it. I used 1 milligram a day. It kind of brought my levels up higher than probably it should have. Dr. Life used to be my doctor. If any of you know Dr. Life, I'm not seeing him anymore. I feel like I actually did my hormones better than he did my hormones. But he put me on 5 milligrams a day of testosterone. And I said, this is going to be way too much. I took it for 3 months. I did it. And my hair was falling out. And I had to stop it. I tested my hormones and it was at sky high testosterone levels. I knew it would be. So 1 milligram of testosterone is pretty typical for a woman unless you're a strong bodybuilder. If you have a lot of muscle mass, you need more testosterone. So if you're not a jogger, but a bodybuilder, if you build muscle, if you are a very, very strong woman, work outside, let's say you are a landscaper, you probably have more muscle, you're going to need more testosterone. Muscle needs testosterone. So I do like testosterone. I'm convincing myself to go get some testosterone. But I got off of it. I just don't, it's somewhat of a hassle. It's so easy for me to use my over-the-counter hormones. So I use my DHEA, my progesterone, and my estrogen. I use the Hormone Heaven. So that has the estrogen and the progesterone in it. I have had higher doses, but right now I'm using the average dose, 2 pumps twice a day. And my DHEA, I use 1 pump most of the days, and then sometimes I use 2 pumps. Okay, so that's very low dosing, and that's appropriate dosing and adequate dosing. Okay. Okay. Thoughts on BHRT for diagnosis of osteoporosis at 55, negative 2.5 spinal DEXA, but history of fibroids and ablation. That's a no-brainer for me. It's an absolute no-brainer for me. History of fibroids and ablation. So don't know what year, Cindy, that you had the ablation, and you didn't mention whether you are postmenopause. I have a feeling that you are either postmenopause or within that 3 years before, 3 years after. You appear to be a small lady. Negative 2.5 is significant. So that's osteoporosis, or that's the first level of considered. So negative 2.5 is the first level you would get the diagnosis of osteoporosis. So critical. Protein is critical for you. Bones are living matter and need protein. So make sure that you're getting adequate protein. Add collagen to your protein shake. Try to get a protein shake in every day. It's just women don't get enough protein. Women who have osteoporosis often are not eating adequate protein. Vitamin D, get your levels up to 60 at you're 55 with a negative 2.5. You may have this in your family, extensively in your family. If you have it extensively in your family, get those vitamin D levels anyway, but know that there is a vitamin D receptor site abnormality that is a genetic abnormality that women and men too. Men get this, men get osteoporosis too, but if they get it, if they get it when they're younger, say before the age of 80, okay, that's really the truth. Before the age of 80, if a man gets osteoporosis, that is indicative of possibly a genetic vitamin D receptor abnormality, meaning that the receptors on, I keep looking up at next week I'm going to bring my Lego receptor model down here. It's up on the shelf. I have so many awesome models. Okay, so this, just like the estrogen receptor site, just like the COVID, the receptor site on cells in the lungs, and they're actually ACE receptor sites, angiotensin converting enzyme, is a receptor site on lung cells and heart cells and other cells that COVID attaches to. Everything has to get in the cell through a receptor site, everything. So imagine the thousands of receptor sites on our cells. Well, there's a receptor site for vitamin D. And if you don't have a healthy receptor site, if you have an abnormality of the vitamin D receptor site, guess what? The vitamin D can't get in the cell. Isn't that great? It can, but you got to push it. It's like the pressure. It's like pushing pressure in there. You've got to get those levels up. So 60 is considered high end of normal, but for people who have long family histories, you can genetically get this tested to see if you have that receptor site. But if you can't get it tested, I'm trying to empower women to do things even if they can't get the test, to look at your past medical history and look at your family history, because you know what? I want to tell you, that's what takes a long time when you're really taking care of people, is that you've got to ask them the questions. You got to find out about them and their families. So if you have this long history and you yourself have osteoporosis with a negative 2.5 at age 55, that's early, then it's likely that your vitamin D receptor site is abnormal. So you need to get your levels up to 60 to 100. 60 to 100. All right. So monitor that. Don't test your vitamin D level more than every 3 to 4 months. because vitamin D is a fat-soluble vitamin and it takes time to make the change. So every 3 to 4 months, double check that vitamin D level and keep it between 60 and 100 if you have osteoporosis at the age of 55. Okay, so you lose most of your bone mass, not you, everyone, every woman on the face of this earth loses most of their bone mass 3 years before menopause and 3 years after menopause. That 6-year window is nasty, very nasty. That's when our bone loss, it's almost the way I picture it. I almost picture a river flowing. You have a bone and the bone is just flowing out during that period of time. That's where, so after 3 years post-menopause, the rate at which we lose bone slows down. So hormone replacement therapy is critical for 3 years before and 3 years after menopause. That's for women who are at high risk of osteoporosis. There are women who are not at high risk of osteoporosis. Man, they are awesome. They have strong freaking bones. What we have to remember is that our bones stop adding strength in our 20s, like age 20. So we're only building bone up to age 20. And so whatever we have at age 20, man, that's what we got. And some of us are born, with smaller bones, smaller bone mass than others, okay? There's a lot involved here. So the size of my wrist, if I put it this way, you can see I have a very small wrist, right? So that's small bones. I was born with small bones. You can get a weight of your bones. You'd be surprised at how little your bones weigh. So there are actually scales. There are high doctor, scales that are more accurate. But even the ones that you can purchase for like 50 or 60, 70 bucks or whatever they are, can give you measurements of how much bone you have. And you can actually watch that number. It's very hard to build bone, but you can build bone. Just a couple of pounds of bone is massive difference on the strength of your bone. And it has to come from weight building. Bone has to come from weight building, weight training. Now people will say, but wait a minute here. I learned that you can build bone from any kind of weight-bearing activity like jogging. Let me clarify that for you. I do not like people to think they're going to build bone from jogging, because jogging burns so many calories that joggers are often thin, very thin. And the thinner you are, the less, let's say you jog for a half hour. The other 23 hours and 30 minutes is getting hardly any pull on your bones. The heavier set you are, actually the stronger your bones are, because it takes effort, more effort for a body to move with fat on it than it does for a skinny person. Right? So skinny people walk, they're hardly putting any pressure on those bones. But heavier set people, when they walk, it's those muscles are pulling on those bones. So jogging makes people skinny. It also does a lot of damage to joints, and I know it gives people highs, but which is wonderful, the good high. But it's just not a good exercise all in all for you as a whole. It's not a healthy way to build bone at all. The way to build bone is really muscle. You can do muscle training without any weights, or you can use hand weights, or you can do machines, but you can even just do your own body weight, squats and push-ups and chin-ups. If you can do a chin-up, that's hard. I can't even do a chin-up. Okay, so good question. Good question. History of fibroids. So I would definitely, you're at 55, I would definitely use hormone replacement therapy right now. The number one help of bone mass is hormones. I would consider testosterone for you, my love, Cindy, because estrogen, progesterone, and testosterone, and DHEA, all four of them, woo, right there we go. All four of them help build bone, but testosterone and estrogen the most. So important, so important. How can I find out why my hair has been falling out over a year? Is there a test I got? That was Lisa. Thank you, Lisa. I think we answered that. Thank you for redoing that, because you know that the messages come and I might miss it. So don't feel like you can't write it again. I appreciate that. Do you accept healthcare visa? I'm not sure what that is. I'm sorry. Healthcare visa. I'm not sure what that is. Misty, tell me what healthcare visa is. You can always write it info. If you have questions, by the way, you know, this is working out really fun. It's a lot of fun to do this and to answer your questions. And we're just going to take it through the end of the month. But that doesn't, but maybe we'll be able to do more. Maybe might not be able to do it every week, but maybe we can do more of these. And so if you have questions, you know, you're welcome to write me. Info, I-N-F-O, at drkarenleggett.com. So that's drkarenleggett.com. So info at drkarenleggett.com. Let's see. Hi, Tammy. Love you. Can some people just not tolerate any BHRT? I'm 3.5 years in surgical menopause and cannot tolerate estrogen replacement. Let me see more. Progesterone gives me vertigo and I'm miserable without, and I'm only 41. Oh, Gemma, my love. So, do you have a lot of fatigue in your life? Are you, what kind of work do you do? Do you have a lot of fatigue? Do you have gut issues? I want you to do this gut cleanse with us. I want you to be present. We're going to be giving the information out for free. You can do it without buying products. You have to work a lot harder and it may not be quite as good, but you can still do it. You can still clean a lot of toxins out of your body without any supplements. Let's see. So I want you to do that. So Gemma, you're a loaded question there. Adrenal fatigue, which is a very controversial name, because conventional doctors don't like to use that. There are conventional names that they will use, but the reason they don't want to use the words adrenal fatigue is because there's no proof that the adrenal glands are actually fatigued. So, you know, everything runs on a spectrum, like we were talking, and there is a condition where the adrenal glands get fatigued, so fatigued that they pooter out, they actually stop working. And that's called Addison's disease. But you see, conventional doctors are black and white. They don't think about things running on a spectrum. And you don't just get to Addison's disease before you've been here, and then 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 here. Unless you had a trauma. You can get to Addison's disease if you had COVID, pneumonia, put on the vent, and then come off the vent. You could go into Addison's disease because the adrenal glands were so taxed so severely and so critically. So sepsis is a condition that we see in the nursing home where they end up in Addison's disease. When that happens, because they had this massive medical condition that put them in the hospital and made their bodies work like crazy, and then they were pumped with everything to keep them alive, and then they came out of it, and they can develop Addison's disease. Many of those people actually come out of it. They actually come out of it, but they don't just come out of it from B to A, perfectly normal. They are fatigued. So functional doctors say there is adrenal fatigue, but we're not talking about, we don't have anything to measure and say, other than cortisol. There's cortisol and DHEAs, but they like to say there's no such thing as adrenal fatigue, but there are these other conditions that cause these problems that look like, you're overstressed. I think functional medicine doctors know how to communicate better with people. So if someone has come up with a term that is used that they can connect with, then we're okay with using it. We're not going to stick our nose up in the ear. So, but I understand why people like to be black and white as well. Adrenal fatigue or massive amounts of stress, and the fact that you're 41 and went through surgical menopause makes me wonder what happened that could have caused your system to be out of balance, which, again, using the term adrenal fatigue in quotation marks, that is a condition that is often something that needs to be fixed before you take BHRT. Women who have weakened strength in their resilience, in their ability to overcome, their body is suppressed, all in all, and we call that functionally adrenal fatigue. I wish it had another name. Have difficult time managing hormones. There's a doctor that specializes in that, specifically for people like that. His name is Dr. Lamb, L-A-M. This happened to him. So he got adrenal fatigue, and he recognized that he's a conventional MD. But when it happened to him, he couldn't get out. He couldn't get out of bed. He was really bedridden, and it was, everything. His career as an MD and on call and all the things. That was exactly what happened to me too. Right? New, fresh doctor. I should be as happy and active and feel as good as I should have felt better than I feel today. I couldn't. When I drove up to the nursing facility, I would have to put my chair back, my back of my little Corvair. I had a little blue Corvair. I'd put the seat back and I'd just rest there for 10 minutes just to get the strength to get out of the car. To push the car door open was hard for me. And I would have to I slept. My mom handed me my protein shake on the way out the door. This was during my geriatric fellowship. And I lived with my mom because I was in a hospital, and we lived in Sarasota, but I wanted to do a geriatric fellowship in Orlando, big Florida hospital there. And my mother lived across the street from Florida Hospital, a neighborhood just across the street. So I lived with her the year I did my geriatric fellowship, Florida Hospital, Orlando, Florida. And she treated me so good. That woman is amazing. But as I would walk out the door, she handed me my protein shake. I get in my car. I never shared with her how I felt. I never shared with anybody how I felt. I was freaked out. I thought I had a cancer. And I would drive to the nursing home. That would be my very first stop, was checking on that. And I would lay back, I'd get in the nursing home, and I would push myself forward. And finally, I realized this is not normal. I am so exhausted. This is not normal. This is not normal. I'm not depressed. I have everything. I have this magnificent husband. I have this magnificent career. And I have this wonderful family. And so I went to an oncologist, a colleague who I knew, and I confided in him, and I said, something's wrong with me. I think I have a hidden cancer, like ovarian cancer or I have something going on. My periods were all messed up too. But that was because my hormones were all messed up. And he said, well, Karen, let's, I trust you. I had everything. I had everything done, from CT scan, bone scan, to look for bone cancer, to blood work out the wazoo, from hemochromatosis to everything, gluten, everything. He did everything. Everything was normal. Everything. So here I am, barely able to function, brand new, trying to, and I was like, this is how I'm going to live. This is what my body's going to feel like. For doctors to tell me that adrenal fatigue, whatever you want to freaking call it, doesn't exist, makes me sad. And it makes me sad for all the people out there that have it. So the long hours and the massive work that it takes to make it in medicine, and, I didn't go back until I was older, so I had a family. I had a very helpful family, but still, you're torn between a lot of things. And I think I had low resilience because I was emotionally affected by medicine. I was emotionally affected by medicine. To see the suffering. I grew up in a fairy tale family. My parents never fought. My parents never drank. My parents ate good food. We had the Fector is my maiden name. We had the Fector trials. If people didn't like what our parents told us we had to do, we got to have a trial. We had a judge, and the rest of us were on the jury. I mean, seriously? I had a fairy tale upbringing, which everything was planned that way to help you. Because when I got into the real world and started seeing how much abuse is out there, because this is what comes to see the doctor, there's a lot of abuse out there. There's physical abuse, there's emotional abuse, and people come to their doctor, they're more sick. And they come to their doctor, and if you're the type of doctor that I am, you tease that out of them. Accidentally, not on purpose. But you get to the root of a person's problem. And when you get to the root of a person's problem, if you're a sensitive individual like I was or am, you can take it in. So all of these things caused my problem, my adrenal fatigue. So adrenal fatigue exists, and hormone replacement is whatever name we want to call it. Let's come up with a different name. Let's come up with a name that conventional medicine will accept. So when you have that, you can have a very difficult time with hormone replacement. You have to re-nurture your system before you can tolerate hormones. So the fact that you had surgical menopause at a young age makes me think, what happened? What's going on? So there's a little bit more going on. Dr. Lamb, L-A-M, his daughter Carrie Lamb, and his son, all MDs, they specialize. You look it up right now, Dr. Lamb, get his newsletter. Oh my God, he's a great writer. He gives a lot of information out, on newsletter. I think I get a newsletter from him every night. I try to read it. It comes out at 4:00 in the morning. I got it last night. So Lamb, L-A-M, love him. Okay, so he does some videos and all that stuff. And he also does private consults. So if I don't know anything about that, don't know anything about his private consults, I've not had one with him. And I've not talked to somebody who has. I haven't followed up as far as that goes. Okay. That was a good question. You are not the only person, Gemma, who has had that. And that's why I'm happy to relay the information of Dr. Lamb. I hope he can help you. All right. Hi, Nina. Okay. I'm looking. Yvonne says, great answers. Thank you, honey. What do I need to do to have your energy level? Oh, you're cute. Well, I want to know after we do the gut cleanse what your energy level is like, okay? Because this is the time, perfect timing for us to do a cleanse. It's turning into spring. The spring is a wonderful time to do a gut cleanse. I hope that the people who are in my Savvy Sister Circle are going to be a couple weeks ahead of you, all of you out there who want to join us for free to do a gut cleanse. So you'll get access to the same private portal that has all the information in it, lots and lots of handouts and lots of videos that help you learn about your body, What I'm doing right now with those videos is I'm cutting them into very short little sections. So I'm doing tiny little sections so you can watch them in the car, like 5-minute little videos or 10-minute little videos, and then breaking each section up so you can watch just a little bit. It's everything from mindset to the cleanse, to the diet, to the supplements, to the, I have a section in there on constipation that I just did last night. Tons and tons and tons of stuff. And you can start you'll get through it. And if you just do a cleanse for 21 days, I want to know what your energy level is like after that 21 days. Now we do start, this is the part that I haven't told you savvy ladies yet, but we do have a 2-day, I don't tell anybody this because I don't want to scare them off. It's so easy, but we have 2 days that we do a vegetable drink fast. It's 2 days, it's a jump start. So we do an organic vegetable drink for 2 days. And you can buy it in your grocery store. I just want it to be vegetable. I don't want it to be fruit. It can't be fruit juice. It's vegetable juice of whatever. You can do carrot juice. You can do vegetable juice. You can do tomato juice. Organic. Everything, it has to be organic. That is for 2 days. And it's not hard. In fact, you just get tired of drinking stuff. You want something to chew. But we have to jumpstart the system. And to jumpstart the system, we do that for 2 days. And the other 19 days are the elimination diet. After the elimination diet, and you'll learn all of this. After the elimination diet, there's another 3 to 6 weeks of challenge diet where we start adding certain foods back in one at a time, 2 foods per week. And it's during that time that I teach about losing weight and keeping the weight off. Okay, so because we're going to go from this massive, wonderful, healthy cleanse, getting all these toxins out of our body, and re-inoculating with healthy probiotics in the gut. And then what happens is your system is running very, very like purring. It's like purring, and you just feel full of energy. It's the time you can really lose weight if you don't go back to the way you were eating, and you take it to the next level of understanding how to eat for weight loss. So first we do the cleanse, and there's some parts that will be partly eating for weight loss, and you do lose weight, but the big part comes after the challenge and during the challenge. So this isn't some little program we're giving away. This is a huge, long connection that we're going to have together, and we're going to have fun. And the Savvy Sisters that are in the circle, since they're going to be ahead of you, they're going to be able to share they're going to be able to help me. Okay, that they're going to be able to help me help you, because I hope that there's so many people benefiting from this that I can't answer everybody's questions. And I'm hoping that what we're doing is that they're going to pop in and be of significant help for you, because they're a few weeks ahead of you. So, Jill, I want to know how you feel when we're done doing that. I just received my saliva profile test kit. Good, Darlene. That's great. Dawn, hi, Dr. Karen. I was wondering how hormones in sunscreen affect us. Can you give me hormones in sunscreen? What sunscreen has hormones in it? A certain brand? I don't use sunscreen, so I have used sunscreen before if I know that I have to be out in the sun all day during a time. I might use it on my face and neck. These are the very sensitive areas. Actually, the shirt that I'm wearing is super helpful. It has some UV protection, but I like the sun, and I love the sun. I think the sun is extraordinarily healthy for you, and I think that those hours in the middle of the day are our most difficult, problematic hours. I know that when I get out in the sun, I feel a whole lot better. I listen to my body, and I know that people who are in Florida, and we do tend to have less certain medical conditions than people who live in cold environments. And so it could be our vitamin D. I don't know. But what happens is when we're younger, we're out in the sun a lot more. We wear our bathing suit and we're getting exposed to a lot more vitamin D. And then as we get older, we don't want to wear our bathing suit. We don't go out as much, and we get bogged down with our work. And so our vitamin D levels go down. And so, that's just a natural process of being a kid and getting to go to spring break and just having weekends off. Who has weekends off? We're out doing chores, right? If we're not working, we're doing chores. So I don't use a lot of sunscreen, so my sunscreen is probably pretty old, even when I'm on a cruise, I rarely use sunscreen because I use a brimmed hat, and I watch for certain times of the day. I don't like the chemicals in sunscreen, to be honest with you. They're our largest organ. Now, our gut, the surface area of our gut, if you stretched our gut out and you stretched all those little microvilli out, that's the longest tissue that we have in our entire body. But the skin is also really our biggest organ. So you can put hormones on your skin and get them into your system. What is in the sunscreens and what's in our products, we're getting into our system too. So we want to use good products on our skin. So sunscreens, I haven't seen much. Zinc oxide, straight zinc oxide is good for the nose, because zinc oxide is wonderful for your, actually. You can actually absorb some of that zinc oxide, and it's good for you. It helps with wounds. It helps with rashes. We use it on our babies' butts, right? Butt paste, the active ingredient in butt paste is zinc. So zinc oxide, which is back in the days when we were kids going out and getting tans, the lifeguards wore the zinc oxide on their nose because that's 100% block. So if I was going to use a sunscreen today, gosh, I don't even think I had any sunscreen on the cruise we took last year. But if I was going to, I would use an organic sunscreen. So I'm not sure about hormones, Dawn, in sunscreen. Whatever you put on your skin is going to affect us. So that's interesting that sunscreens have some hormones. That's kind of weird. Let's see. Darlene, I ordered a saliva profile kit. I'm looking to try the topical BHRT from your site. Was this the proper saliva test? I gotta see more. Why is that not coming? Was it, so you got a saliva profile 1 that is definitely there we go. Is this the proper saliva test order? Yeah, any of the saliva kits would be fine. I mean, it depends on So you could do a saliva profile 1. That includes your cortisol, and it includes your estradiol, progesterone, your ratio of progesterone to estrogen, your DHEA, and your testosterone. That's saliva, and cortisol. That's saliva profile 1. And then that looks like this. They all look like this unless you're getting our AccuMap. We're also coming out with some more AccuMaps because we're trying to get costs down. So they're still ZRT kits. Our kits, it's just that we order the labs that I'm creating my kits to order to include estrone, because you have to add that on, estrone, to any of these. And I don't like that because a lot of people miss that. So all I'm doing, I have to show you, it's so simple. This is complete transparency. But in the kit, there's a little card in the kit. See here? It's just a card. And I tell ZRT, it's the same thing. ZRT is doing these kits for me. Our AccuMap 5 is a ZRT kit. But Yvonne, our magnificent graphic artist, she made the artwork, and we sent it to ZRT, and they print and cut these little labels, put them in there. Same kit. It's just that it has estrone, and I took the cortisol out. So cortisol, but you see, some people are wanting the saliva kit, because profile 1, because they want they want to see what their cortisol is, or they want to see what their testosterone is. So we're going to be doing a bunch. We have 4 total AccuMap. They're not 5. So there's AccuMap 5, 7, 10, and I think it's 12, because we're going to also be doing one of these. Because what I found is that people are benefiting. They really like me to read all their labs, even though I don't have a product to fix their thyroid issue. I have suggestions to fix a thyroid issue. So they're liking that part. So I might as well go there. I'm just trying to find out what people want, and if they want it, I'm trying to give it. So that's that. All right, Elaine, glass half empty versus half full. Yeah, exactly. Can some people just not tolerate? Oh yeah, we are. Sorry, I already read that. It is something in the Savvy Sisters vitamin. I have narrowed it down in the packets to 2 pills that are, so it's the 2 pills amino acids. Huh. Never heard of it, Jody. I'm going to have to investigate that. There's nothing else in there except amino acids. Your acid, do you do any, I don't have it here, it's in the she shed. Do you do any enzymes? Do you take your Savvy Sisters with your meal? They need to be with a meal. And that's number 1. And number 2, do you use any enzymes? And number 3, do enzymes to help break down food? And if the answer to that is no, when you don't take your Savvy Sister supplements that you've narrowed down to the amino acids, good deductive work, girl. I love that. Do you get any heartburn after any other meal? Any other meal? That diet diary, did you do it? That diet diary? I haven't seen a single diet diary come across my Savvy Sister group. Shame on you. Okay, I question the safety of a vaccine that is being rushed into approval. Me too, honey. I'm a little worried about that, but I think here's what's making me feel good about that. Okay, this is really rational. Okay, this is really rational. Okay, if you recall, I just went over the whole time frame a couple of days ago with my husband, because I've been watching this like a hawk from the very beginning. And if you recall, our first case came out on January 21st, right? January 31st, we had a border close from China. February, vice president, it was announced that the vice president was going to head up a task force of COVID. For 2 weeks, nothing happened. I was freaked out because I'm watching it and I'm like, where are these people? Right? Trying to stay calm. I'm trying to write and do these posts about how everything's fine, but I'm really thinking and I'm really bitching, right? At home, I'm saying, where is this vice president and where's this task force and what are we doing? 2 weeks have gone by, That was February, first 2 weeks of February. I'll tell you what happened. Now, hindsight's 2020, we know exactly what happened. What happened was our CDC, who my son works for, he's a veterinarian and an epidemiologist. And he went into this as a veterinarian to investigate zoonotic diseases. Zoonotic diseases are diseases that animal gives to people. That's a zoonotic disease. So this is like his baby. So what happened those first 2 weeks is the CDC was trying to get a test to test for COVID. And only the CDC. Because the FDA, the rules and regulations in our country are such that, or were in February, such that everything has to go through FDA for approval, unless it's made by the government. So the CDC was the only organization that could make a test to find out who has COVID. So the CDC was trying, but how many great minds are in the CDC compared to the great minds of the entire country? I mean, this entire country is packed with talent, right? And companies. So those first 2 weeks were like nothing but red tape after red tape after red tape. And then on week 3, they recognized that there was a problem. And the problem was the red tape. They couldn't get anything done because everything had to be put through the FDA. So they had to use another 2 weeks in Congress, the entire Congress, to reverse, I wouldn't say reverse, to temporarily reverse and take the restrictions off of all the things that we needed in this country to make things go fast. So the second 2 weeks was nothing but Congress working their little fannies off. Thank goodness, finally, right? So the second 2 weeks of February, they were working hard to reverse and change the laws so that things didn't have to go through FDA. And that took another 2 weeks. So the whole month of February was like lost, right? Nothing was happening in the month of February. And then March 1st came out. All the laws were lifted. And then we got this ability to bring in all the companies, the private companies, to make Quest and Abbott and these, I think, 4 major companies to make tests. So we had literally the first case, January 21st, that wasn't the first case. The first case was long before that, but the first known diagnosed case was January 21st. So it took all that time, lost time, and that's where the downfall was. So that saying, you got to get out of your own way? Well, that's what happened to us. We were in our own way. So all those laws were lifted. They're going to be put back into action. The FDA was, created to protect us. They do go overboard. I mean, they go way overboard. You could have something that definitely cures, like look at the seizures for children with marijuana, right? Childhood epilepsy. It's pathetic that we can't have medical marijuana for children in every state for epilepsy. I mean, to me. That's just crazy. We can have an opioid epidemic, but we can't have medical marijuana for children with epilepsy in every single state. Don't even take me there. But, so here we are now in March, everything's kind of picking up. I mean, we still have tested more people than anywhere. We're a huge country, but we've hardly tested anybody compared to how big of a country we really are. And so we want to, I don't even know why this came out. So here, the question, the vaccine. So what takes 18 months normally to have a vaccine is a lot of the red tape. So without that red tape, I think we will be able to get a vaccine faster. And I think that we'll actually be able to get us vaccine out just as safe as if all the red tape was still there. I think. I mean, let's look at the hydroxychloroquine right now. They've been testing it at different doses because phase 1 of all tests is, there's 3 phases to a test. Phase 1 is always the test you don't want to be in, okay? It's the test you don't want to be in, the phase you don't want to be in. So phase 1, you got to start somewhere, but phase 1 is determining the lethal dose of a drug. What is the dose that you can give people until you have adverse reactions? Significant adverse reactions. We're not talking about nausea and headache or diarrhea. We're talking about death. So they found out that, so they're giving different doses of hydroxychloroquine, right? They had to stop the high dose one. The other doses are still in trial. Nothing's happening because the highest dose that they were using, which I think was 600 milligrams twice daily or something. The dose we know of hydroxychloroquine is 2 grams a day, but they weren't using 2 grams a day. They were using, I think it's 600 twice daily. So, and this is very interesting because the 600 dose twice daily were causing abnormal heart rhythm, which can cause death. So that part of the arm, so think about it, there's several arms with several different doses. So 200 twice daily, I think it is 400 and 600 twice daily, and they've stopped the 600 twice daily because there were too many people getting abnormal heart rhythms. So that became phase 1, we're stopping the high dose here. That doesn't mean the drug, hydroxychloroquine, isn't still good or isn't still going to be good because it will go into next phases, phase 2 and phase 3. But once they determine the lethal dose, once they determine by these poor people who had a heart problem, and remember, COVID is going to affect the heart anyway. It gets in the heart muscle, but on top of that through the ACE inhibitor, but also because anytime the lungs can't breathe, the heart has to work a whole lot harder. The heart is trying to get more blood through the lungs because it wants more oxygen. And if it can't, it's going to work harder and harder. So it's already going to be impaired. And then, so the 600 twice daily of hydroxychloroquine was too much, even though we know that the dose, the really bad dose of causing just normal, if let's say you're just walking down the street and let's say you have coronary artery disease or hypertension or whatever, but you're well controlled and you take 600 twice a day, that's not the dose that affects people. That's not, it's 2 grams a day. 2 grams is the dose that is the max dose. But for sick people, they found it to be 600 twice a day. So what they're finding now is, they're a loading dose. The best way to use hydroxychloroquine, and stuff is going on in all different hospitals. And when you are in a hospital and in a trial, you have to do what they're doing. You don't necessarily get the best one, right? You get the one that hospital is doing. So right now they're looking at changing the dosing of a hydroxychloroquine to do a loading dose of 800 milligrams for the first, I think, 2 days, 48 hours, maybe it's 72 hours, 800 milligrams a day, loading dose, and then go to 200 twice a day. 200 twice a day is fine. thousands and thousands and hundreds of thousands of people are taking 200 milligrams twice a day. That's a very safe dose. Taking it right now as a preventive and for other medical conditions too. Lupus, rheumatoid arthritis. It's an old drug, old successful drug. So I'm not going to worry. That's where I'm going to stay. I'm going to stay up here. I'm not going to worry right now about the COVID vaccine. I'm going to see what the COVID vaccine comes up with. I'm going to see what we've got. And I'm going to believe that the reason vaccines take 18 months is because of we get in our own way with the federal red tape, FDA red tape. And therefore, since that has been lifted, we could make 10 months or 12 months and we could have a vaccine within 10 or 12 months. I believe that. I actually do. It's going to be interesting. We'll be talking about this more next year. We'll be talking about, hey, I was right, or hey, I was wrong. How do we know how much more? Oh, Jen Bell. Jen, my darling, how much more what? Please message me on where and what to order on the topical hormone. Oh, honey, you need to see our website, my love. www, of course, that's the old person to say that, drkarenleggett.com. And there is some wonderful information there that will help you get started. Okay, ablation at 47, Cindy. I'm going to, after all of this is over, we'll go back and pick up answers or questions that I didn't get to or didn't finish, and then we'll do that next week. We'll start where I started with the gal, just waiting for people to come, and I talked about the arthritis. Okay, my finger's better. Okay. I have MS, 62 years old, hysterectomy, can't seem to lose weight. Okay, yeah, that's a loaded question, hun, because with MS, there are hormone, we know about hormones at increased, low hormones at increased risk of MS. And then, of course, MS, interestingly, is more associated with New England, Northeast, down. If you live the first 15 years of your life in a Southeast state, you have first 13 years of your life. If you were born in a Southeastern state, live the first 13 years of your life, then move to New England, your risk of having MS ever in your life is almost nil. It's almost nil. So this tells us something that we don't know about MS. Is it something in our environment? Is it something that we are exposed to down here in New England down here in Florida during the first 13 years of our life? Is it something that the first 13 years of your life, if you're living in New England or in the northeastern area, that puts you at higher risk? We don't know. Does estradiol help build bone? Yes, it does. It requires higher doses, and that's why you will see, because it's a weaker estrogen. So it's our weakest estrogen, Estradiol E3. It does help build bone. It does help skin. It does help with collagen. It does help with elasticity. It does help with hair. It does help with bones, as you're asking. But the doses need to be higher, and that's why we do an 80-20. So you'll see on estradiol, the amount of estradiol that you get is higher than the amount of estradiol. So we need higher doses. You're welcome, Lisa. Oh, thank you, Yvonne. Yvonne put it out, info@drkarenleggett.com. Thank you. Thank you, everybody. Thank you, Allison. I've been thinking about you, Allison. Okay. Can adrenal fatigue also be from emotion? Oh, honey. The question is, can adrenal fatigue also be from emotional trauma? Like a big fat yes. Yes. This up here is the commander in chief. And what is up here, we suppress a lot of stuff. We don't remember a lot of stuff. What do you remember in your childhood? We actually remember the trauma stuff. The one time my parents got in a fight is what I remember, right? They got in a fight, and I remember my dad getting mad, and I remember him staring up at the ceiling. I was so scared. And I didn't see that before, and it scared me. But I can't imagine a person seeing this day in and day out. Or I can't imagine a person being abused or hit or yelled at or belittled. You could just be belittled. Your self-esteem can be affected. I can't imagine what many, many, many people go through. And that's what I found out when I became a doctor, because people started coming to me and telling me stuff. I didn't know that. I thought being a doctor was taking care of sores and cuts and rashes and sore throats. And, I had no idea that it actually had so much to do with taking care of the emotion, the soul. That's really the biggest part to me of being a doctor. The most important part. All that other stuff, every doctor should be able to take care of diabetes and heart disease and all that stuff, right? Every one of us should be able to do that. But the emotional aspect of healing is really where it's so critical. My daughter-in-law is a pediatric psychologist, and she's a PhD. And what she sees in her practice is horrific. And she knows so much more than I do. I mean, as far as the emotional aspect of healing, it's just crazy what she knows. I don't know how she does it. But she actually had to get out of the one-on-one. She now is in charge of a whole bunch of psychologists, pediatric psychologists. But it gets to you. I think even if you're a strong person, she's a very strong person. She has a lot of techniques. So, yes, adrenal fatigue is very much associated with emotional trauma. And emotional trauma starts when? When does emotional trauma start? There's some people that say that it starts in the womb, right? So when does that start, right? Because this guy up here remembers everything. Okay, can DHEA cause hair shedding? Yes, it actually can. Your DHEA levels can get too high. The amount of DHEA that you need is actually a little bit different. It's a little bit harder than estrogen and progesterone. You want to start low, very low, and then move up slowly. So DHEA can cause hair shedding. Now, you have to also remember that hair shedding is a natural process, but only for about 2 weeks. All right, 2 to 3 weeks, and hair shedding should stop. And the hair shedding part of the hair life cycle is not every couple of months. It should be like once a year. Like dogs. If you've ever noticed, like sometimes dogs will go through their shedding period. So once a year, you might have a couple of weeks of shedding. But if you're going longer than that or more frequently than that, then yes, there can be more involved. It's the dihydrotestosterone. It could be too much DHEA. DHEA converts to testosterone. Testosterone converts to dihydrotestosterone. And it's the dihydrotestosterone that causes the shedding. And is there something that I can take to prevent this? Yes, dihydrotestosterone blockers. Okay, so they're called 5-alpha reductase blockers. 5-alpha reductase blockers. 5-alpha reductase blockers, the most common one is saw palmetto. So there's saw palmetto, pigeon, green tea, tons of them. I'm going to answer that better next time because I'm going to show you a product that I think is fantastic and inexpensive on the market that I use when I go through little shedding phases, but I'm not in a shedding phase right now. Okay, I missed the beginning. Yes, I did. Hi, Barbie. Okay, you guys are all out of hormone heaven, so I ordered hormone support. Oh, I'm so sorry. Hope it helps as I am only 2 years post-meno. Yes, we got out of hormone heaven. We got out of, but I have good news. I have good news. We thought it was going to go on for as much as a month. We thought it was going to go on as much as a month, but I think by this weekend, we will be able to restart. I think by Monday, we will have a supply of Hormone Heaven. It'll be a small supply, so don't all go buying all at one time, but it'll be a small supply. But we were informed this week, yay, that we're going to have our restoring Happy Hoo Hoo back, our rebuilding. We're almost out of that. If we're not already out of that, I think we are already out of that too. So the supplier issue with all of this going on, that was a big problem. And so we are going to be able to send out Hormone Heaven starting Monday, and our supply is just going to get bigger and bigger now. So I'm so grateful. It did not last the month that we were afraid. And then, it really only lasted about a week and a half. So I'm so sorry about that. I am super, super sorry about that. You're probably going to want Barbara to switch to Hormone Heaven back again. And if you want to do a switch, that's fine. Okay, should I get a separate test for estrone? The first time you test estrone, the first time you test your hormones, if you don't get an estrone level, and you're not taking any hormones, if you don't test your estrone level, that's okay. I like to see people have a baseline estrone level because you need to know what your ratio is, how you convert your estradiol to estrone, and how much estrone you're actually producing on your own can be seen at baseline, which is nice. If you don't have it, then you definitely want to order it. If you start hormone replacement, you want to see how you're converting the estradiol, because remember, estradiol will convert to estrone. Some converts to estriol and some converts to estrone. Now, to prevent that bad conversion, there is a supplement, DIM, diindolylmethane, and then there are other supplements also in addition to DIM, but diindolylmethane is the strongest, and it comes from cruciferous vegetables. So if you need a separate test for estrone because you've never tested it before, you can add that to the kit that you have. You would have to write us because it's already been bought, and we have to call ZRT and let them know that was added. So I would do info@drkarenleggett.com. We do have a phone number, but it's faster if you do. It's 888, I think, Savvy Sis, SAVYSIS. But I think it's better if you just go info@drkarenleggett.com, and we can add that estrone. If you want to wait to do the estrone later after you've been on hormones for about 3 months or whatever, definitely add the estrone on there. But if you want to get it now, no problem. We can take care of it. I have the diary. Wasn't sure what to do with it. Renee, I'm proud of you. Okay, Hormone Heaven is temporarily out. Yeah. When will it be available again? Yes, next week. Yay! Thank you. I would love to know the supplement because I love your DHEA product and have been using it. I love your DHEA product that I have been using. I have been using very little. I seem to be sensitive to the conversion. I did go off. I'm sensitive to the conversion too, honey, so I understand. I did go off of testosterone because of this and thought I would try DHEA, which I love. Yes, I am the same way. Yes. Are you small? DHEA level was low last time I had it checked. Thank you. And remember, if you want to get the actual DHEA level, not the DHEAS level, that it's just not accurate. Just know that you are absorbing the DHEA. Now the DHEA also, without the sulfur attached to it in the liver, also can go through the blood-brain barrier. So the blood-brain barrier, oh my God, it's 222. I didn't realize that. I love it. Okay, so what I want to do, yay, and we still have 27 people on. I'm so happy about that. So what we're going to have to do is I'm going to answer one more question because I see there's one more question left. So I'm going to answer that one question. If you have more questions, though, go ahead and write them on here. Go ahead and write them on, and we'll monitor it, and we'll start with those questions first next Friday. So the last question is it safe to use estradiol, progesterone for an active, thin, petite, 75-year-old, no comorbidities? What do you suggest? I picture myself. Active, thin, petite, 75-year-old. So, a few years older, 15 years older. Am I going to use it then? Yeah, I am. So do I think that active, so there's controversy on if you don't use hormone replacement therapy and then you start on hormone replacement therapy later, does it give you the same benefits? There's controversy on whether it gives you the same benefits. Well, you know why we don't know? The reason we don't know is because we've never done it. We've never tested that. And anybody that's going to test it is going to test it with synthetic hormones. So I hope that nobody does do that until they do it with bioidentical, because you don't want to use a synthetic progestin. They're not going to test a bioidentical progesterone because they don't make one, except Prometrium. That's all they have. They can't, there's no money in it. So why are they going to make it? So I would treat a 75-year-old active, thin woman like I would treat a 60-year-old active, thin woman. And I would keep testing. I would watch. I would make sure that the estrogen level did not exceed twice the estradiol level. So if the estradiol, and I'd keep them in that nice, safe little estradiol zone at about 5 or 6. That's where I like mine. So normal estradiol level is, if you're on hormone replacement, is between 0.8, too low, and 12, I think a little too high. So that's the reference range. So I kind of hit for 5 or 6. I go for the middle, right? So, some people feel better at 12, but I kind of go for the middle. I would certainly go for the middle if I'm 75. So, but you want to make sure that there's no estrogen dominance, that the progesterone is adequate. I had one person in 3 years not absorb the progesterone. One person, in 3 years, and I didn't see her name on here. And she's been buying the, the $97 thingamabobby where I go over the labs and give them recommendations. She's been doing those. And she's been doing them every 4 or 5 months. And she's been doing them in purchasing that. And I've been going over it with her. And we've been working on her progesterone level for a year and a half. And she's done everything that I asked her to do. Everything. Including don't use a moisturizer on your skin and then put your hormones on top of it because it will stay in the moisturizer. Your skin won't absorb it. Get those hormones in your skin and put your moisturizer on 2 hours later. Okay, so I know it's a hassle. But ladies, we've got to use topical hormones so we don't increase our risk of stroke, high blood pressure, and DVT, deep vein thrombosis. Okay, because topical bypasses the liver, and if you use topical hormone replacement, you do not have increased risk of that. You use an oral estradiol, you're going to increase your risk of stroke and deep vein thrombosis. So we've got to use topical. So if it's a fat-soluble product, hormone, you got to get it in there. So unfortunately, our crepey, or however they say it, the crepey skin moisturizer has to wait for 2 hours before, after we put on our hormones. Okay. So that's important. So she's done all of that because I thought that's why she's not absorbing progesterone. Now, she does have hypothyroidism. When you have hypothyroidism, for some reason, topical progesterone, not estrogen, not DHEA, but progesterone. And this is why BioT, they don't use this is one of the reasons that they don't use subcutaneous progesterone, because it's harder to absorb topical progesterone than it is the estrogen and DHEA. Okay, and testosterone too. If you use topical testosterone, it's easy to absorb. Estrogen's easy, testosterone's easy, and DHEA is easy, but progesterone can be stubborn. So the amounts of progesterone that she was needing was crazy. She was using 80 milligrams of progesterone a day, and she was still estrogen dominant. I said, okay, that's it. All right, that's it. You've done everything. We did everything to make your progesterone come up. You have done everything. And you know what? She lives in Florida. So guess what? I picked up the phone. I did a teleconference with her, and I prescribed her progesterone, compounded long-acting progesterone, because and I didn't charge her. And I'm going to stay her doctor. I made a folder for her. She'll still buy tests, but I had to do it because she's estrogen dominant using Hormone Heaven. And the progesterone, she was using Hormone Heaven, a small amount of Hormone Heaven, a whole bunch of Hormone Protect, postmenopausal, still estrogen dominant. So we want to test. In other words, we still want to test. I mean, I want to help everybody and help them understand if you use these small amounts, you're not going to be, in a danger zone. So I feel comfortable with that. But if I could get everybody to test, then I would be even more comfortable. If I could just clone me and then have and just do everybody on the phone to look at every single person's labs, I feel even better. That would be even more fun. But my point is, I just sent her an email. I sent the email to Millie. Millie sent her an email and said, we need a consult. We need a one-on-one consult. I'm going to give it to her for free, and I'm going to ask her. I think she needs compounded progesterone. We put her on a long-acting progesterone. I called the pharmacy, called it in. She lives down in Palm Beach area, and in a few months she'll retest her progesterone, and she wants to do other tests. And I'll look at it, and she's the first one, and she's the third one in my history in the last 20 years of prescribing bioidentical hormones that wasn't able to absorb the progesterone. But that's 3 people in 20 years. So that tells me that, it's out there. So she does have low thyroid, but she doesn't have any thyroid issues right now. So I don't really think it's that. There are it's just a rarity that you can find in the literature. It's a rarity, but some very rare occasion, a woman cannot absorb her progesterone topically. Okay, so thank you so much. That was so much fun. I can't believe how much time went by, 2.5 hours. Thank you so much for being here. We are going to go through the questions, make sure that they were all answered. I'll start next Friday at 12, and we'll keep doing this. I love the fact that you guys want to take care of yourself, and I love the fact that you guys are interested in learning. And here's the other thing. Would you do me one favor? Just one favor. Actually, would you do me 2 favors? Would you first tell me what you do for a living, if you're a homemaker, or if you had any interest in any kind of medical field, like nursing or CNA or pharmaceuticals or anything like that. Would you put in the comments if you had any of that history? That's the first thing. And the second thing is, would you share this video? Would you share this with other people? Just click on share to my friends or whatever, however you do it. Share. That would be so nice and would be great, because I want to reach more people. And we need to reach more people. because we manage and we change the aura of our environment. Okay. Love you, love you, love you, love you. Okay. I will see you next week, hopefully, and more. Okay. Love you. Bye-bye.